Hello, dear friends. This is Sofya Dorinskaya with you, President of the International Bureau for Human Rights in Mental Health and head of the Sofya Dorinskaya Center for Medical Information. It's been a while since we've seen each other. Summer has passed and now it's autumn. I would like to start, so to speak, the working year with a conversation on the topic of treating intellectual disability. Over the summer, I received a lot of questions on this topic. Many people reached out asking for help. So let's talk about what intellectual disability is, whether it can be treated and what can be used to treat it. And what do antipsychotics have to do with it when we talk about treating intellectual disability? Intellectual disability is a delay in mental and physical development. This is what's called oligophrenia. And this is not classified as a medical disease. It is instead defined as a specific physiological condition. It is a certain state of the body in which, to put it in more general or simplified terms, the system finds itself unable to successfully achieve the expected level of mental and physical development. That would normally be considered appropriate for its chronological age. It is not a disease. If we turn to old textbooks, my favorite is Portnov, specifically the old Soviet textbooks. Here, the causes that can lead to oligophrenia or intellectual disability are not only prenatal injuries to the fetus, I'll read it to you directly, but also, in a number of cases, various factors that affect the body as a whole and the brain in particular during the period of growth and personality formation. They can cause varying degrees of mental and physical, varying degrees of delay in mental and physical development. Among such factors are infections that selectively affect the central nervous system, meningitis, encephalitis, skull injuries, syphilis, and intoxications. In some cases of oligophrenia, congenital toxoplasmosis is detected. The rubella virus, with which a pregnant woman may be infected, affects the fetus and subsequently leads to the development of oligophrenia. There are indications of the significance of phenylpyruvic acid, the synthesis of which in the body is severely disrupted in certain types of oligophrenia. In some cases, oligophrenia is caused by congenital brain malformations. You should understand that oligophrenia is a condition, and this condition has a cause. It could be some kind of intrauterine problem. I can say that nowadays pregnant women are prescribed a huge number of different medications. Perhaps in some cases this is justified. Most likely, in a very large number of cases, it's simply the prescription of some substances. But all medications have side effects. And it should be understood that the increase in intellectual disability, oligophrenia nowadays, may be due to the massive pharmaceutical impact on girls, on women, on pregnant women. And all of this can already affect the child who is born. That is, during the period of intrauterine development, a certain toxic effect of medications prescribed to pregnant women can be the cause, and this may later lead to intellectual disability in the child. In other words, this is a certain heterogeneous impact, some pathological conditions that have not been identified. It is important to understand that when a child is born, their body transitions from one environment to another. The gastrointestinal tract actually has to learn how to absorb nutrients. This whole cycle of nutrients and the development of the body, it needs to the nervous system needs to mature. A child is not born fully developed. What is the growth of the body? Nerve endings mature, organs and tissues develop. Naturally, the condition of the gastrointestinal tract plays a huge role in this. A huge role is played by how quickly the newborn's gastrointestinal tract adapts and begins to absorb nutrients. Because roughly speaking, any time lost at the start will make itself felt later on. If the gastrointestinal tract, to put it simply, takes a long time to adjust and can't adapt to the new conditions of existence, this affects the child's development. It's a certain state of the body. So how can we help with this condition? Since intellectual disability is not a disease but a condition, and any condition can be either chronic or temporary, that is, lasting for a certain period of time, I will now show you how each of us can be intellectually disabled at times. Please try to remember yourself. When you've worked 10 to 12 hours, when you haven't managed to eat that day, maybe you had a very stressful day. To put it bluntly, you were completely drained. Maybe you were freezing somewhere, you walked a long distance, or something else happened, and you came home and you can't even think. You start forgetting words, you can't remember the names of ordinary things, you look at a frying pan and realize you can't recall the word for it. This is usually accompanied by very strong irritation. If you're a man, you come home. Your wife, who has been at home all day taking care of the children, starts unloading her problems on you, and you start yelling at her. This is accompanied by irritation. Here you go. This is a demonstration of transient mental retardation. This condition is called asthenia in a person. How can you, as a person experiencing this transient mental retardation, get out of this state? You need to eat and rest. You need to eat and rest. So this is an instant, well, a short-lived state, and it is also characterized by certain characterological changes such as aggression. Imagine yourself after 10 or 12 hours having not eaten anything and being tired. You come home and you need to learn a huge chapter on advanced mathematics for an exam the next day. Will you be able to do it? But a person who has slept all day, rested, and is in good physical shape can do it right now. If you both sit down at the same time, the person who is rested compared to you will seem smart, and you will seem like an idiot. You will seem mentally retarded. So just consider this situation. How can you get out of this state of mental retardation that has come over you? Eat, get some sleep, and maybe even take a day or two to rest, just lying on the couch. Tell me, please, can something like the antipsychotic risperidone help you get out of this state? This is the antipsychotic that, as our clients and parents write to me, well, I don't know, psychiatrists have 2 antipsychotics that they prescribe to children with intellectual disabilities nowadays, risperidone and Sonapax. So let's take a look at what the antipsychotic risperidone actually is. Absolutely all antipsychotics are designed to block the functioning of the nervous system in one way or another through various mechanisms. Why? Because their goal is to deal with psychosis. That is, they need to stop this psychosis. They need to block the functioning of the nervous system. And the effects on the body are very clearly demonstrated by the side effects. So let's take a look at the side effects of risperidone. From the side of the nervous system, insomnia or drowsiness, increased excitability, fatigue, impaired attention, restlessness, anxiety, headache, dizziness, tardive dyskinesia, extrapyramidal disorders, which is when your hands or legs tremble. So poisoning, malignant neuroleptic syndrome, the child is taken to intensive care, impaired thermoregulation, seizures, stroke. So you come home hungry, forget your words, yell at your wife, she gives you a pill instead of a bowl of borscht, and you have a stroke. Blurred vision, cardiovascular system issues, hypotension, and tachycardia. Gastrointestinal tract, nausea, vomiting, constipation, elevated liver transaminases, impaired liver function. Genitourinary system, amenorrhea, impotence, erectile dysfunction, ejaculation disorders, anorgasmia, decreased libido. This substance is prescribed to preschool children 2, 3, 4 years old. Angioneurotic edema, these are allergic reactions, galactorrhea, and so on. So tell me please, can any of you create a logical chain explaining how, in a state of fatigue, asthenia, the inability to recall words, aggression due to extreme exhaustion, how can this substance cure such a condition? Can anyone, any reasonable person, construct this logical chain and then, after applying it in practice, achieve a positive result? Sonapax is actually not the best substance. Well, here it's about its active ingredient. Hypersalivation is when a person loses saliva and the food bolus isn't properly moistened, which leads to impaired digestion. Amenorrhea is the same, but here it can go as far as sudden cardiac arrest, even death. So, my friends, it is impossible to cure intellectual disability as a condition. We can only improve the living conditions of the organism. And what does that mean? It means a calm, friendly environment, actually identifying real pathologies like toxoplasmosis, for example, and treating them. It means eliminating nutrient deficiencies. Never forget that. One of the most striking manifestations of vitamin B3 and zinc deficiency is intellectual disability. And until you know for sure, until you find out and check whether a child's intellectual disability is a consequence of nutrient deficiencies, you should not, under any circumstances, approach them with any toxic substances. God forbid, even if that is not the cause. Neuroleptics block the functioning of the nervous system, which is already under extremely harsh conditions and cannot fully develop. The body suffers, and neuroleptics, I will repeat once again, are simply meant to finish off this unfortunate child, to turn them into a disabled person. And to put it quite cynically, to rid society of this person as quickly as possible. That's the truth, because you won't get any other result. So, is it possible to cure intellectual disability? No. What can be done? You can very scrupulously, very meticulously determine exactly which inhibiting factor in this person's body is preventing them from fully developing. And once you have precisely identified this factor, address it, treat it, eliminate nutrient deficiencies, and restore proper gastrointestinal function. By effectively eliminating this restrictive and inhibiting biological factor, you provide the opportunity for the body to grow and develop fully to its natural physiological norm. I hope I have answered the parent's question. There are a huge number of letters with stories about how neuroleptics were prescribed to a child with intellectual disability, and everything only got worse. Why does this happen? And again, let's be completely honest. Before giving your child a neuroleptic, try taking it yourself. That would be fair. And see what happens to you over the next 12 or 24 hours. And then think about whether this substance can actually help your child. This was Sofya Dorinskaya. All the best. Goodbye.